welcome. My job is to plug the Women's Center. It's getting easier to do each year. Most people know about it now. It's not a kept secret. But those of you who don't, I do want to just give a few words on what we have and what we have to offer. And I've been doing this a long time, so now I got to use glasses. So, our mission has never changed when we opened in 2007, and that is we're committed to providing women an environment that has hallmarks of warmth, dignity, safety, supportive, and very caring. And those who actually have used the center or been there kind of describe it as a spa-like environment, and that's really what we were shooting for. Things are stressful enough in life that when you have to come and do things that are required for your health, that we offered something that was safe and supportive. We offer a variety of diagnostic and wellness programs. It's emphasized with a strong multidisciplinary approach to the continuity of care for women with diseases of the breast. And examples of our multidisciplinary team approach to breast health, which is really how breast health is handled today, begins with our healthcare providers, and in particular the physician collaboration. We're very fortunate in that we have a really, really strong, supportive team of physicians that are looking to help better the lives of women in this community. And that includes medical oncologists, surgeons like myself, radiation oncologists, pathologists, radiologists, and we actually get together twice a month to discuss new breast cancer cases or challenging cases or just to follow up on cases to make sure we're all on the same page and that this person's getting the best care available. So I may see somebody in my office, but I always emphasize to them that you're going to get maybe 2 or 3 opinions that you see, but you're actually getting the opinions of over a dozen people that are getting together to make sure we're all in agreement that this is the best care, this is the best route we do for your care. We have the nurse-navigated system that you know about Laura and Polly. That program is second to none. I've seen and viewed a lot of places. What they provide for you is second to none. And that I could spend an hour just talking about what their roles and responsibilities are. But the best compliment I can give people is that in the old days where people were just lost and confused on how to try to get things taken care of, they take care of it for you now. So they relieve so much stress in people's lives when they're diagnosed with breast issues. We provide high-risk screening to women and have actually diagnosed a couple of breast cancers or pre-malignant lesions based on this high-risk screening. We offer genetic risk assessment and testing. It's combined with UC San Francisco for women who are considered high risk and require genetic testing to help determine how their care is going to be best served, and also to help their relatives as well. We offer lymphedema services, and that's not just for the treatment of lymphedema, but also for preventative. They're excellent about providing women exercises and lifestyle changes that prevent lymphedema. We see such a small variety of lymphedema like compared to the old days, and it's really because of the services that they provide. And then we offer a wide variety of different education and support systems that Laura and Polly can share with you. We are an accredited center, and I'm proud to say that we were the first accredited center of excellence for treatment of breast diseases in Northern California. We were the 3rd on the West Coast when it first opened. The University of Washington, Seattle was one, and then Scripps in San Diego. So that was really a tremendous accomplishment of which a lot of people deserve credit for. We've been re-accredited since then. It's a 3-year process, and we've been accredited twice since then. We're due again coming up. What does that mean? Well, if you're an accredited center of excellence recognized by the American College of Surgeons, it means you're part of a consortium of both national and professional organizations that are dedicated to the improvement of the quality of care for women and monitoring their outcomes of the diseases of the breast. We do it through vigorous standards that we set up and are held accountable to, through scientific validation, and through patient and professional education. The center, for those of you who have not experienced it, offers a wide variety of access to patient-related information, education, rehab, support services. There's a pre-op teaching program that's headed by our nurse navigators that help women prepare for surgery and the whole operative process. We have support groups for women who are going through treatment of breast cancer all along the line, including survivorship programs. Again, I've mentioned the lymphedema clinic and the genetic counseling, but we also offer yoga, massage, Pilates, wellness classes, nutritional programs, and we have a library that if you haven't had a chance to access it is just amazing. A wide variety of information, and it's very culturally sensitive with that. So again, I mentioned our mission is to help improve the quality of care, and some of the metrics we look at and follow, I'm just going to describe a few of them, but this is some examples of what we're held to in terms of standards. So if someone comes in for a screening mammogram and an abnormality is identified, the time it takes for them to get to additional testing, such as a diagnostic mammogram or an ultrasound. If you look at the national average, it's about 2 weeks, which is a lot better than it used to be, but it's still about 2 weeks. That's a time period that can be very, very taxing to women emotionally and mentally. And our numbers are 5 days. And that's amazing considering insurance issues today and authorizations and everything else. And that's directly attributed to Polly and Laura, you know, getting involved early and getting this whole process streamlined. So those numbers we're very proud of. Women who've had a diagnosis of an abnormal mammogram to the time they have tissue diagnosis, again, it's 2 weeks is the national average. Those numbers are markedly improved again, but it's still 2 weeks. Our numbers are 8 days. It's hard to get it lower than that because a lot of people are on medications like aspirin or blood thinners that have to be stopped a week before they can have a procedure such as a biopsy. So probably not realistic to get it under 7 days in that. So we're probably at the absolute maximum number of which we can get this done, and we're really proud of that because, again, you know, it relieves, it's a week less of time of stress and everything, worrying about their biopsy, what it's going to show, et cetera. Core biopsy rates, in the old days when somebody came with an abnormality on their mammogram, they'd come see a surgeon, they'd set up a surgery, and they'd have that biopsied, and that had its own set of issues: cost, time, expenses, risk of surgery, et cetera. And today we don't do that. We do what's called core needle biopsies, either under ultrasound guidance or stereotactically, which means under mammographic guidance. And there's a lot of advantages to that. If the biopsy is negative, they never have to see a surgeon or undergo a surgical procedure. The national acceptance rate is core biopsies is about 85%. So 85% of people who have an abnormal mammogram, that should be their first line towards tissue diagnosis. Ours last year was 100%. Breast conservation, women who have a diagnosis of breast cancer have choices today. Mastectomy is one of them, but also breast conservation, the layman's term is lumpectomy, is also an option. The national average is they'd like to see at least half the patients who are diagnosed who have a disease that's amendable to either breast conservation or mastectomy have breast conservation. Ours was 60%. We're starting to see a swing. We don't know if it's the Angelina Jolie factor or not, but we're definitely seeing a swing where women are opting towards mastectomies, even prophylactic mastectomies on the opposite side. That's, the whole nation is seeing that. So those numbers, it's tough to get a 60% number with that, because ultimately it's the patient's choice, right? The good news with women who opt or have to have mastectomies is we have a very vigorous plastic surgery program that's intimately involved with the Women's Center as well. And so we offer a wide variety of different reconstruction options for women who end up with mastectomies. Re-excision rates, this is women who come in, have a surgical removal of either a pre-malignant lesion or a cancer. How many of them have to go back to surgery for additional surgery? If you look at the national average, it's 1 in 4. And that's, you know, an amazing number, and it carries with it a lot of issues with it. But that's been the number. It's been steady since I've been doing this for years. Our re-excision rate last year was 3%. I think it has to do with a lot of factors. I'm not going to pat myself on the back because there's lots of surgeons who do this, and so it's all of us together. But it does point to, we're really proud of it because it really relieves a lot of issues. Cost, going back to surgery, time wasted, time delayed for other treatments, et cetera. So this is a really impressive number that nobody that I know has been able to compare it to. And it looks like our numbers are going to be similar for this year as well. Sentinel node identification. At the time of surgery, when women have the procedure done, whether it's a mastectomy or breast conservation, we identify the sentinel node, which is sentinel is the guard to your armpit. And that is the leading lymph node that we want to identify and remove. And the reason why we do that is to help stage the cancer, to help determine treatment. It also helps us that if we remove that lymph node and it has cancer in it, we know we need to do additional work in that armpit. And we make all those decisions before surgery, but we deal with it intraoperatively if that's what we find. But it's not that easy to find. We have techniques that we use here to help us find it. The national average is about 85%. And it's important because if you don't find it, then you're kind of committed to doing a more aggressive surgery because you can't afford to not find it and to have it turn out to have cancer and you've understaged or undertreated the patient. Ours was 94% last year. It's been 100% in the past. It's hard to be 100%. A lot of women now get treated with chemotherapy before surgery, and that makes it a lot more challenging to find these lymph nodes because quite frankly, they're destroyed. So it's hard to be 100%, but our average is 94%, which I think is pretty good. Finally, this is a really neat center. For those of you who have not accessed it, it's kind of really a jewel in this area. It's close to where you all live. I would strongly advise you to look at it and access it. You'll get a lot of people taking care of you, maybe even more than you want, but it's really dedicated by professionals who are really here to help you. I always tell everyone, I finish this speech with, I'm extremely jealous because we don't have the same thing for men. There's not something out there like this for men. And so, take advantage of it. It's fantastic. And I'll be around to answer any questions you may have. And thank you for your time. Have a wonderful day. Thank you.